Hey, I want to ask you something, and I want you to really think about it. By the end of the day, do your ankles look like they belong to somebody else? Are they puffy, tight, maybe a little shiny? Do you press your finger into your skin and leave an indent that stays there for a few seconds? If you're nodding right now, you are absolutely not alone. Swollen ankles affect tens of millions of Americans over the age of 60. I see it every single week in my practice. And here's the thing that frustrates me most as a doctor. Most people are told to just take a water pill, put their feet up, and hope for the best. But today, I'm going to show you something completely different. I'm Dr. Alan Mandell, and on this channel, we believe that your body has the power to heal when you give it the right signals. Today, I'm going to walk you through 6 simple chair exercises that target the exact mechanism causing your ankle swelling. You will not need to stand up. You will not need any equipment, and you will not need a single pill. Stay with me all the way to exercise number 5, because that is the one that most doctors never explain to their patients, and it may be the most powerful one of all. Let's get started. Before we jump into the exercises, I want to take just a couple of minutes to explain what's actually happening inside your body, because when you understand the why, you'll be far more motivated to do these exercises every single day. Here's the basic situation. Your heart pumps blood down to your legs through your arteries. That's the easy part. Gravity helps it along. The challenge is getting that blood and all the fluid surrounding your cells back up to your heart. That job belongs to your veins, your lymphatic system, and, this is the key, your muscles. Now, as we get older, a few things happen. Our veins lose some of their elasticity. The tiny valves inside them that keep blood from flowing backward start to weaken. Our lymphatic system, which drains excess fluid from our tissues, slows down. And, if we're being honest, many of us are spending more hours sitting than we used to. Here's what happens when you sit for a long time. The muscles in your calves, which act like a second heart, squeezing blood and fluid upward with every step, they go completely quiet. Gravity takes over. Blood pools. Fluid seeps out of your capillaries and settles in the soft tissue around your ankles. That's your swelling. Now, some causes of swelling do require medical attention. If your swelling comes on suddenly, if it's only in one leg, if you have pain or redness or warmth in the leg, please call your doctor right away, because those can be signs of a blood clot or a serious infection. Same if you have chest pain or shortness of breath. But for the majority of people over 60, what you're dealing with is chronic, gravity-driven, circulation-related swelling. And that, I am delighted to tell you, is very fixable. The exercises I'm about to show you will activate what doctors call the calf muscle pump. Every time your calf contracts, it squeezes the deep veins in your leg and literally pushes blood up toward your heart. It's your body's own built-in drainage system, and we are going to wake it up right now. All right, exercise number 1. This is called the ankle pump, and it is the foundation of everything we're doing today. Here's how you do it. Sit up nice and tall in your chair, both feet flat on the floor. Now, keeping your heels on the ground, I want you to pull your toes and the front of your foot up toward your shin as high as they'll go. Hold that for just a second, and then slowly lower your foot back down and press your toes into the floor. Then back up and down, up and down. That motion, That simple flex and point is activating your calf muscle with every single repetition. Every time you pull your foot up, that calf contracts and squeezes. Every time you push it down, it releases. You are literally pumping fluid out of your ankle and back up into your circulatory system. I want you to do 20 repetitions on each foot. You can do both feet at the same time or one at a time. Either way is perfectly fine. Then rest for about 30 seconds and do 2 more sets. So that's 3 sets total. Now I want you to pay attention to something. After your first set, do your ankles feel even just slightly different? A little less tight? Maybe a little tingly? That's circulation returning. That's your body waking up. This is your warm-up. Don't rush it, don't skip it. This exercise alone, if you did nothing else, would make a meaningful difference in your daily swelling. But we're not stopping here. Exercise number 2 is the seated heel raise, and this one goes a level deeper. Same starting position. Sit tall, both feet flat on the floor. Now, instead of flexing your foot at the ankle, I want you to press down through the ball of your foot and your toes and raise your heels up off the floor as high as you can go. Feel your calf engage. Hold that position for 2 full seconds at the top. And then, here's the important part. Lower your heel back down slowly. Take about 2 seconds on the way down. Up, hold, and slowly down. Now, here's why that slow lowering matters. When your calf muscle lengthens under tension, what we call an eccentric contraction, it generates more force and more pumping action than the lift itself. Most people just drop their heel. Don't do that. Control the descent. That's where a big part of the benefit lives. Do 15 repetitions, rest 30 seconds, and repeat for 3 sets. If you want to add a little challenge, you can place your hands on your thighs for light resistance as you lift. But even without any resistance, this exercise is remarkably effective. Physical therapists use this as a primary treatment for venous insufficiency, poor circulation in the veins, because it directly targets the exact muscle group responsible for pushing blood back to your heart. After a few days of doing this consistently, many people tell me their ankles look noticeably thinner in the morning. Give it a week. You will feel the difference. Exercise number 3 is ankle circles, and this one is about range of motion and lymphatic flow. Lift your right foot just a few inches off the floor. Now, using your ankle, not your whole leg, I want you to draw a circle in the air with your toes. Make it as large as you possibly can. Think about it like you're trying to draw a dinner plate on the floor with your big toe. Nice, big, slow, controlled circles. Do 10 circles going clockwise. Then reverse it. 10 circles going counterclockwise. Then set that foot down and do the same thing with the left foot. That's 1 set. Do 2 sets on each foot. Here's what this exercise is doing that the others aren't. The ankle joint is surrounded by a dense network of blood vessels, lymphatic channels, and connective tissue. When you move your ankle through its full range of motion, not just up and down, but in every direction, you're stimulating all of those structures at once. You're loosening up stiff connective tissue that can restrict fluid movement. You're nudging your lymphatic system to drain more actively. Many of my patients who have stiff, creaky ankles in the morning find that just 2 minutes of ankle circles dramatically increases their comfort and mobility before they even take a step. One coaching note, go slow on this one. The slower and more deliberate you are, the bigger the circles, the more benefit you get. This isn't a race. You're painting a picture with your foot. Take your time. Exercise number 4 might make you feel a little silly at first, but trust me, stick with it. This one is more powerful than it looks. Place both feet flat on the floor. Now I want you to spread your toes as wide apart as you possibly can, like you're trying to put space between every single toe. Spread them out. Hold that for 3 seconds, and then slowly curl all your toes downward, like you're trying to grip the floor with them. Hold that for 3 seconds, then release. Spread, hold, curl, hold, release. Do 15 repetitions and 2 sets. Now, why does this matter for swollen ankles? Here's something most people don't know. The sole of your foot contains over 100 muscles, tendons, and ligaments. It also sits right on top of a critical collection of lymphatic vessels and nerve endings that, when stimulated, trigger increased lymphatic flow through the entire lower leg. In traditional reflexology and modern sports medicine alike, foot activation is recognized as a legitimate tool for improving circulation in the ankle and calf region. When you spread and scrunch your toes, you are activating musculature that most people never consciously use. You're improving the microcirculation right at the site of your swelling. I also want you to notice something. For many of you, spreading your toes wide will actually be difficult. Your toes may have been compressed together in shoes for decades. That restriction in the foot contributes to restriction in fluid movement. The more you practice this, the more mobility you'll recover, and the better your circulation will become. All right, exercise number 5. This is the one I promised you at the beginning, the one that most doctors never get around to explaining. And honestly, of all 6 exercises today, this may deliver the most dramatic results. It's called seated marching, and it's almost insultingly simple, but the science behind it is remarkable. Here's what you do. Sit up straight in your chair. Now alternate lifting your knees, left, right, like you're marching in place. Lift each knee high enough that your thigh comes close to parallel with the floor. And here's the key detail that takes this exercise to another level. Swing your opposite arm as you lift each knee. Left knee up, right arm swings forward. Right knee up, left arm swings forward, just like real walking. Do this for 30 seconds. Rest for 15, and repeat 4 times. Now, let me explain why this works so well. When you walk, actual walking, you engage the largest muscle groups in your body: your quads, your hamstrings, your glutes, your hip flexors, your calves. All of that muscular activity creates an enormous pumping effect on your circulatory and lymphatic systems. 30 minutes of walking is one of the most evidence-backed treatments for chronic ankle edema that exists. But many of you can't walk for 30 minutes. Maybe your knees hurt. Maybe your balance isn't what it used to be. Maybe you're in a small space. Seated marching replicates the circulatory benefits of walking without any of those barriers. Adding the arm swing is not just for show. Research on lymphatic function shows that upper body movement significantly increases lymphatic drainage in the trunk, which creates a downstream pull that helps drain fluid from your lower extremities faster. Cardiologists recommend this. Vascular surgeons recommend this. And now I'm recommending it to you. Exercise number 6 is our grand finale, and it brings everything together in one beautiful, deeply therapeutic movement. Here's how to get into position. Cross your right ankle over your left knee so that your right leg forms the shape of the number 4. Your right ankle should be resting just above your left kneecap, with your right knee pointing out to the side. If this is uncomfortable for your hip, you can also just rest your foot on a low stool or a stack of books. Now, place both thumbs gently on the inside of your right ankle, that soft, slightly tender spot just below and behind your inner ankle bone. Got it? Good. Now apply gentle downward pressure with your thumbs. Not hard, just firm. While you hold that pressure, slowly flex your foot upward, pulling your toes toward your shin. Hold that for 10 seconds. Then point your foot downward, away from you. Hold for 10 seconds. Then back up. Do 5 repetitions, then switch legs and repeat. Here's the significance of what you just did. The inner ankle area you are pressing on is home to a major lymph node cluster, the medial ankle lymph nodes. By applying gentle compression while moving the joint, you are manually stimulating lymphatic drainage from the foot and ankle into the deeper lymphatic vessels of the leg. This is a simplified version of a technique used in professional manual lymph drainage therapy. At the same time, the figure 4 position gently stretches your piriformis and hip external rotators, muscles that, when tight, can actually compress the lymphatic and vascular channels running through your pelvis and slow drainage from your entire lower extremity. This exercise does a lot of work quietly. Don't rush it. Okay, let's pull this all together so you have a clear plan you can start today. Here is your complete 15-minute routine. Exercise 1. Ankle pumps. 20 reps, 3 sets. About 2 minutes. Exercise 2. Seated heel raises. 15 reps, 3 sets. About 2.5 minutes. Exercise 3. Ankle circles. 10 circles each direction. 2 sets per foot. About 2 minutes. Exercise 4. Toe spreads and scrunches. 15 reps, 2 sets. About 2 minutes. Exercise 5. Seated marching. 30 seconds on, 4 sets. About 3 minutes. Exercise 6. Figure 4 ankle stretch. 5 reps per leg. About 3 minutes. Total time, approximately 15 minutes. I recommend doing this routine twice a day, once in the morning before you start moving around, and once in the evening, especially if you've been sitting for long periods. If you travel by plane or car, do it before you land or before you get out of the vehicle. Most of my patients who follow this consistently begin noticing a visible reduction in swelling within 3 to 7 days. A few lifestyle additions that will amplify your results. Elevate your legs above heart level for 20 minutes before bed. Drink at least 6 to 8 glasses of water daily. Dehydration actually worsens fluid retention. And reduce your sodium intake. Salt tells your body to hold water. I want to leave you with something important. Swollen ankles are not just a cosmetic problem. They are a sign that your circulation needs support, and your body, at any age, has the ability to respond to that support when you give it the right kind of movement. You don't have to resign yourself to tight shoes, uncomfortable evenings, and a drawer full of water pills. You have something far more powerful than any medication sitting right inside you, and it's called your muscular system. All we need to do is activate it. 15 minutes a day, 6 exercises, a chair. That's all it takes. Now I want to hear from you. Leave me a comment below and tell me, which exercise did you feel the most during this session? Was it the seated marching? The figure 4 stretch? I read every single comment, and your feedback helps me create the videos that help you the most. If this video brought you value today, please share it with someone you love, a spouse, a sibling, a friend, because nobody should have to suffer from something this fixable. And don't forget to subscribe and hit that bell so you never miss a new video. Coming up next week, the 4 foods that make ankle swelling dramatically worse. You may be eating them every single day without realizing it. You won't want to miss that one. I'm Dr. Alan Mandell. Take care of yourself because you deserve to feel great. I'll see you in the next video.